Hello, everyone, and welcome to Abstract Writing Key Strategies for Success. I'm Darby Christ, a D&P student at The Ohio State University, and today I'll be walking you through key strategies for writing effective abstracts, especially for the Ohio Organization for Nursing Leadership Conference, also known as OONL. Whether your project is research, quality improvement, or evidence-based practice, these tips can help you turn your work into a clear, concise, and competitive abstract. The objectives for today are to explain the reason for an abstract, understand the essential elements that should be included in an OONL abstract. Example, the problem, purpose, description of project, methods, evaluations, results, and future implications. And provide examples of well-written abstracts to illustrate best practices. First off, congratulations! You found something that you're excited about or want to share, and that's worth celebrating. But I want you to know that it's a story. Every good abstract is a story, even if it's not written like one. Behind every project is a moment of inspiration, a challenge, a question, a patient encounter that sparked action. This why gives your abstract meaning and guides how you shape the rest of it. If you keep that story in mind while writing, it'll help you connect with your readers, even in just 500 words. And you also want to know, how can you light the fire in others? Think about how to light that fire. You only have a few lines to hook your reader. That opening sentence is like a spark. It can ignite curiosity, emotion, or relevance. Ask yourself, why should a reviewer choose my abstract for a poster? Catching their attention early means they'll be more invested in reading and later visiting your poster. Things to also remember is you want to be professional when you write. Avoid first person. You want to stay more in the third person. You also want to avoid citations. And you want to ask yourself, is your project research, QI, or EBP? If you're not sure, we'll go into that in a later slide. And remember, the point of the abstract is to summarize your project. So what is an abstract? As mentioned on the last slide, your abstract is a brief summary or overview of the contents of the paper or your project. For OONL, you have to do this in 500 words or less, and it can be formatted in a structured way or an unstructured. Structured format has headings like background and methods, or an unstructured format, which reads more like a paragraph or a single paragraph. We'll look at examples of both later, but it is key that you know what's required before you start writing. So what type of project is it? Research, quality improvement, or evidence-based practice? If your work is research, you're building on testing knowledge. You likely have a hypothesis, IRB approval, and a formal data analysis plan. If it is a QI project, this aims to improve processes. Think like PDSA cycles or outcome metrics. If it's EBP, it applies evidence to practice, often including clinical expertise and patient preferences. Clearly stating your project or clearly knowing your project type in your abstract helps reviewers know what to expect and keeps your content aligned. So this is the outline for the abstract. You have your title, problem, background, description of the project, methods, results, and future implications. The OONL recommends this basic outline, and it works for most abstracts. You start with a clear title, followed by your problem or purpose. This sets the stage. Then the background provides context and evidence supporting your project. The project description and methods show what you did, and results reveal your findings, and the future implications answer, so what? But let's get a little bit more into it and take a deep dive. So let's start with the title. What's in the name? And the answer could be everything. Your title is your first and sometimes only chance to grab attention. Think of it as your advertisement. Keep it simple and direct, and make sure it accurately reflects what your project is about. OONL requires 12 words or fewer, and your title shouldn't give away your conclusion. A good title sparks interest without overpromising. Clarity always wins over cleverness. So let's look at a few examples. A scope and review of the use of deliberate practice in undergraduate nursing education. This lets the reader know that they should expect a scope and review over deliberate practice in undergraduate nursing education. It is clear and direct. Our next example, There's No Daisy Without Sunshine, is a vague title. We have an idea of what Daisy is. Maybe it's the Daisy Award. And maybe you know what the Sunshine Award is, and maybe you don't. You don't want to leave that up to the reader. You want to be clear. Clinical nurse specialist coaching improves transition preparedness in older adults. This tells the reader everything, and they might not come to your presentation because of that. They already know that clinical nurse specialist coaching improves transition preparedness. So they might skip to something they want to know more about. And the last one, the use of checklists in undergraduate nursing. This could be made more clear if it were to tell you where it was used, if it was psychomotor, if it was in the affective, or if it was in cognitive. So even this one, while it is close, can lead the reader to go astray. Now let's get into the background and the summary of evidence. This is where you set the scene. What is already known and what's the gap? Use your background to give just enough context. What does the literature say and who's affected? A brief summary of the evidence can indicate that a change was required and let your reader know why you went to solve this problem. Now, let's get into what is the problem. You can look at this similar to the format of the S-bar, the situation. What is the problem that prompted the project? Why is it a problem, and what's the situation? Include what is to be discovered or the purpose of the study. You can use a line like, the purpose of this project was to improve, and you'll fill in the rest. This helps reviewers immediately understand your intent. The next section of your abstract is your methods, and this just tells your reader exactly what you did. You're going to describe your intervention step by step, include the setting, the population, and the tools you use, whether that's a checklist, training module, or survey. Don't over-explain, but give enough for someone to understand and replicate the work. Other things to consider is what population was involved in your study. Were they adults? Were they children? Were they males? Were they females? Was it a certain group that had a disease process? Let us know. What target measures did you set to improve with your metrics? Those are also great questions to answer. On the next slide, we'll see some examples of methods. Our first example is this randomized controlled trial investigated the effect of a 6-month social media-based intervention on adherence to controller therapy and asthma outcomes in adolescents with asthma. 100 adolescents were recruited from a pediatric asthma clinic. 50 were randomized to each group. The intervention group enrolled in a social media-based platform wherein they received a daily notification designed to motivate health behavior change. The usual care control group attended routine clinic appointments. Medication adherence, asthma-related hospitalizations, and emergency department visits were evaluated at baseline and 6 months using self-report surveys and retrospective review of the electronic health record. That tells the reader exactly what they did step by step, and it was also very concise. That one's going to be more of a clinical trial, whereas this next one's probably more of a QI. It is a QI. And it starts with the Plan, Do, Study, Act method of quality improvement. That'll right there tells us it is quality improvement. Was used for this project. Baseline assessment included review of patient medical records 6 months before the intervention, documentation of pain assessment on admission, routine pain assessment, reassessment of pain after an evaluated pain score, discussion of pain in multidisciplinary rounds, and documentation of pain assessment were reviewed. Literature review and listserv query were conducted to identify neonatal pain tools. That tells the reader exactly what was going on. Moving on to results. Now we're on to the results section. This section should clearly communicate what you found. Use data where possible. even if you don't have statistical significance. Look for clinical significance or positive trends. For example, pain reassessment documentation improved from 0% to 47% post-intervention. That's meaningful. Keep your outcomes tied to your aim. If your project was set to improve documentation, show whether it did. If your aim was behavior change, describe how you measured it. Also think about sustainability. Can these results last over time? Could this be replicated? That sets your project apart as more than just a one-time success. As we see here in our example, results of the pre-intervention and post-intervention survey scores indicate by Cohen's D a small effect demonstrated clinical significance and an overall positive shift towards improved health behaviors and beliefs. One of the 3 participating schools districts demonstrated a 7.5% increase in healthy behaviors 4 weeks post-program completion. They are letting their results and their numbers and their data speak for them. Now, these are all positive examples. However, your study may not have gone the way that you thought it would, and that is worth sharing too. That helps your reader know that they should not do this study design or this quality improvement, and that too can save them time. Now we've made it to the conclusion, the final piece of your abstract. It's your final word, your mic drop moment, if you will. It should be succinct and meaningful, reinforcing your purpose and the significance of your results. Avoid the temptation to introduce anything new. Instead, focus on what the reader should take away. Ask yourself, how does this impact nursing practice? Does it call for additional education, policy change, replication in other settings? And remember, brevity matters here. The best conclusions are simple, confident, and clear. Let's take a look at this example. Identification and implementation of a multidimensional neonatal pain assessment tool, the NPASS, improved documentation of pain in our unit. Although improvement in all quality improvement monitors was noted, additional work is needed in several key areas, specifically documentation of reassessment of pain following an intervention for an elevated pain score. This tells the reader exactly what to expect when doing the results. Now let's take a moment to look at other abstracts that can help guide you. Our first example is a structured example. As you notice, we have background, methods, intervention, results, and conclusion. I will let you pause so you can read on your own time. Our next one is structured as well. It has background, purpose, methods, outcomes, and conclusions. This one is similar. Background, objective, methods, results, conclusions, and implications for nursing. Remember, different organizations will require different things in your abstracts. This abstract is an unstructured abstract, which too is fine. Here are the references for this presentation in case you wanted to know about these things further. In closing, remember, an abstract tells the story of your work, but in its most distilled form. Use the structure as your guide. Keep your writing focused and aligned to the project type. And always start with your story. If you need help, reach out. Writing an abstract is a skill, and like anything, it gets better with feedback and practice. Thanks for spending time with me today, and I look forward to seeing your future work at OONL. Thank you.